Hi, I'm Dr. Shel. I'd like to talk to you a little bit about heavy metal toxicity. The analysis of the levels of toxic metals in urine after the administration of a metal detoxification agent is an objective way to evaluate the accumulation of toxic metals in our bodies. Now, even though acute metal poisoning is rare, it is very common, however, to have a chronic low-level exposure to toxic metals that can result in a significant retention in the body of unhealthy metals that can be associated with a vast array of adverse health conditions and definitely leads to chronic diseases. So the test can be useful for many things, such as cardiovascular disease, depression, dermatitis, poor wound healing, detoxification therapies, chronic fatigue, gastrointestinal symptoms, hypertension, low immune function, inflammation in the body, nutritional deficiencies, Parkinsonian-like symptoms or Parkinson's disease, ALS, MS, bone density issues, alopecia or hair loss, and so many more conditions can be associated with having high levels of toxic elements in your body. So one cannot draw, especially as clinicians, we cannot draw valid conclusions about these adverse health effects of metals without really assessing the net retention that our patients might have in their bodies. For example, when my husband was diagnosed with ALS, which is a neurodegenerative disease, we did a wide array of testing because nobody knows the causes of so many diseases, including Lou Gehrig's disease, Parkinson's disease, the neurodegenerative diseases that I mentioned, Alzheimer's, different cancers. So we really need to look under every rock, every stone when we're dealing with these chronic diseases. And yes, we found that there was retention of mercury and lead in his body. We were able to address that by doing chelation therapy and get him to slow down his progression. Similarly, when I see patients in my office and we are able to find out what may be retained in their system, in their bodies, as far as heavy metals go, by doing this very simple urine collection, where we have a specific way of doing it, and I'll explain that to you. But when we do these tests, we are then able to see what metals, if any, are being retained in their body that may be causing some of the chronic diseases or the symptoms that our patients are coming in with. It is important for an individual to realize that toxicity occurs when net retention exceeds your physiologic tolerance. Net retention is determined by the difference between the rates of assimilation and excretion of the metals. So to evaluate the net retention, we have to compare the level of metal in the urine before and after the administration of a pharmaceutical metal detoxification agent such as EDTA, which really pulls out the lead, DMSA, which pulls out mercury, and such agents. And so there is a specific way of testing for heavy metals. A lot of people are proponents of doing it with some hair analysis, etc. The gold standard for looking at heavy metal toxicity is by doing a chelation challenge test and then collecting urine for anywhere from 6 to 24 hours after it. It is important to perform both pre and post provocation urinalysis to permit the distinction between ongoing exposures to the metals and the net bodily retention. So the pre-provocation urine collection can also be utilized to assess the rate of creatinine clearance if a serum specimen is also submitted. Many of us clinicians, we also request the analysis of essential elements because we want to look at essential elements in urine specimens also sometimes, depending on what's going on with you, to evaluate the nutritional status and the efficacy of mineral supplementation during metal detoxification therapies. So it's important because when we do metal detoxification agents, when we use those, they can significantly increase the excretion of specific nutrients such as zinc, copper, manganese, as well as molybdenum. We always make sure that we're doing the right blood tests to go along with it to see whether your kidneys can can tolerate chelation procedures. But the first step is we need to find out, do you have heavy metals that are being retained in your body? And some of the ones that we test for are aluminum, antimony, arsenic, barium, beryllium, bismuth, cadmium, cesium, gadolinium, this in the contrast that a lot of people get when they get CT scans. Lead, of course, most of you have heard of. Mercury, nickel, you've heard of. Palladium, platinum, thallium, tellurium, thorium, tin, tungsten, and uranium. These are the ones that we are really looking for, because when you are retaining these metals, certainly you're going to have symptoms, and it could range from fatigue and insomnia to weight gain and hair loss to serious conditions such as neurodegenerative diseases or cancers or other autoimmune conditions. So do yourself a favor. If you're not feeling good, let's look and see what might be causing you to not feel good. That is the entire function of the integrative medicine and functional medicine that we practice, is to really assess the root cause of what might be going wrong in your body.